behalf of KPMG, I really would like to welcome you here this evening, and it's really great to see so many friendly faces after coming out of the pandemic for a few years. My name is Sebastian DiStefano, managing partner here at KPMG in Toronto. I want to pass on Elio's regrets. Our CEO, Elio Luongo, was supposed to host the evening tonight, but he's being blessed with a miracle because one of his children's expecting a child any minute now, so he's in Vancouver. So he would be here. He sits on the board at St. Joe's in connection to St. Mike's, and I sit on the President's Council. So thank you, Doctor, for making time this evening.
Ladies and gentlemen, I'm very excited today to be able to come here and meet you and to tell you a little bit about the University of Toronto Division of Cardiovascular Surgery, and more importantly, to introduce our star speaker, Dr. Gianluigi Bisleri. But besides our long-standing sort of global leadership in areas like reconstructive valve surgery and heart failure surgery, we have long had a desire to expand our leadership role in minimally invasive cardiac surgery. Now, why is that? We know that minimally invasive cardiac surgical approaches, when you don't need to split the breastbone in the way that we normally would for heart surgery, has the potential, obviously, to completely eliminate the potential side effects that come with that approach. More importantly, it allows for better and quicker recovery, so that patients go home from the hospital sooner, they go back to work sooner, they feel like themselves more quickly. And so that sort of mental and psychological recovery from heart surgery, and more specifically, suddenly being told that you have a life-threatening heart problem and you're going to need major heart surgery to fix it, that is much, much enhanced when you have these kinds of minimally invasive approaches. But not everybody can do this kind of thing. In fact, it's really in the wheelhouse only of a handful of surgeons. So we were very pleased when we were able to recruit Dr. Bisleri to the University of Toronto. And so Dr. Bisleri, as you may know, trained originally in Italy, then moved to Canada, and we were lucky to recruit him from Kingston a few years ago. He currently serves as the Director of Minimally Invasive Cardiac Surgery at St. Michael's Hospital. He's an Associate Professor of Surgery at the University of Toronto. We know that he has very specific and very rare expertise in minimally invasive approaches to valve disease, like the mitral and tricuspid valve, and he is an international leader in the minimally invasive approach to surgery for specific heart rhythm disturbances like atrial fibrillation. So with that, I'm going to yield the lectern to Dr. Bisleri. John, I'm looking forward to your talk and to hearing more about this groundbreaking work that you're doing.
Well, thanks everyone for being here. Bob, thanks so much for being really the mastermind behind this event, and thanks obviously CIBPA, University of Toronto for supporting this, and obviously KPMG for hosting this event. So my interest in cardiac surgery actually started when I was a medical student, and I didn't really have a very clear idea what actually cardiac surgery meant. And I remember as a medical student, I just asked to attend the cardiac surgical division there at the university I was attending, and I saw a beating heart. And probably in this room, Dr. Yao can be the only other person who can witness that it's really something completely astonishing to see a beating heart, and also what we can achieve by actually stopping the heart, working on the heart, and getting the heart back to life. It's something that it's incredibly emotional and incredibly powerful. And that really was something that drove my strong interest in trying to really get into this field. That was, for many years, as Dr. Yao mentioned, has been mostly based on an excellent treatment with a lot of very strong techniques, but that required a very large incision in the front of the chest. And that has been something that has changed progressively over the last roughly 15, 20 years, not very quickly. And that's why when I was also myself during my training, during the last part of my training, I actually decided to actually go on a journey that brought me the first time on this side of the ocean, where I actually spent some time in a fellowship at Columbia University in New York, where I was really exposed, and that was actually 20 years ago this time. So, but I was really exposed to the kind of the dawn of the minimal invasive cardiac surgery that was starting to tackle many problems, from the mitral valve, some of the valves in the heart, the atrial fibrillation. It was really very exciting and very, very pioneering times. And that was a really important experience for me as I then transitioned back to Italy, and together with my colleagues also when I started as a staff surgeon there, we really were lucky to be at the forefront on many topics in cardiac surgery, from being the first center that treated atrial fibrillation, this very common irregular heart rhythm, without opening the chest, without stopping the heart. We really developed a very, very large practice in treating many common heart valve problems, and we became an international training center. So that really we spent a lot of time trying to move away from this very effective treatment that requires opening the chest, and trying instead to find alternative ways that, as you can see, were minimizing how much we're opening the breastbone, in some cases avoiding going for small incision on the side using cameras. In some cases, as you can see on the right part of the slide, even going completely, we use the word endoscopic. It's actually a keyhole incision. So we really have a very, very minimal approach. And in many cases, we don't even stop the heart. So it's fairly incredible. And that's why I was very fortunate and honored when I had the opportunity to join obviously University of Toronto and Temerty Medicine, because you've heard how much this institution and obviously at St. Michael's Hospital have been playing a key role in pioneering many of the treatments that have really shaped how medicine is done. And that was really an important place where it was possible to try to focus also on trying to continue to impact not only what was at this stage anymore my journey, but what's really important, the patient journey. Because we don't have to forget that it's not just about the incision. We tend to think often about minimally invasive cardiac surgery just minimizing the length of the access that we use. But we have to remember that what's important for patients actually starts before and actually continues after the surgery. So it goes in preoperative, during the surgery, but also postoperative. So what's really important for patients, and I guess that's what I've learned from many of them, it's that obviously patients want an effective treatment and a treatment that can last over time. And finally, if possible, a treatment, an option that can be the least invasive as we can offer to them. So what are the options that we can offer in minimally invasive cardiac surgery? Well, we can tackle valve problems, we can tackle problems that are related to irregular heart rhythm, and in some cases also coronary disease. So when there are blockages that we can do procedures like bypasses. Most of my practice is in particular focused on treating problems with the valves and irregular heart rhythm. And what does this mean? And this is an example of a very common problem with one of the valves in the heart called the mitral valve, when you may have heard of people having the prolapse of the mitral valve, which is a leaky mitral valve. So this valve that gives this murmur, fairly common. And I find very fascinating this type of surgery because it requires a particular focus also as a surgeon in trying to repair the valve as much as we can. It's actually becomes a sort of specialized area for most of us, since it really requires imagining how the valve can be reshaped in almost like a tailor fashion from a leaky one into a functional one without replacing that with a artificial valve. And imagine doing that, which is per se not the most simple act we can do in cardiac surgery, doing that in a less invasive way, as you can see here, using these approaches that are really allowing just a tiny incision that really almost disappears on the side of the chest. We now use cameras so that our hands are no longer in the chest of patients. We have long dedicated instruments we use in order to access the heart of the patient. So it really requires a dedicated skill set from that standpoint. And really, what it means, as you can see here, in a conventional surgery, we have to perform this large incision in the front of the chest, divide the breastbone, and in this case, we have a very small incision between the ribs without, as I said, opening the chest and allowing still, as in a certain way, we actually, as minimal invasive surgeons, often argue that we have even better view because we can use these cameras that are really providing us unparalleled view of what we are working on. And another example of a very common problem that people are facing, and you may have heard about, it's called atrial fibrillation. It's an irregular heart rhythm that actually affects almost 2% of the general population, so it's a really very common problem. And this problem has been tackled, and obviously surgery is not the first line therapy, but when medications fail, when catheter ablation fails, surgery is an option that was not available until many years ago. And I've been, again, fortunate that I've been doing this for the last roughly 15 years. And right now at UFT, we are the only center in Canada offering this kind of procedure. And we are now going to train other surgeons in Canada so that we can start expanding this option for patients. And when we treat atrial fibrillation, we make sure also to reduce the likelihood of patients to develop a very serious complication, that is stroke, that can be associated with atrial fibrillation. And again, we have these dedicated tools that allow us to treat the heart condition. In this case, it's called the left atrial appendage. It's a site in the heart where clots can be formed, so that we can effectively reduce the likelihood of patients to develop potential stroke. And I'm very lucky that I have a patient I recently had the opportunity to take care of, Mr. Di Francesco, who I would like to ask to join me on the podium. As you will hear, Mr. Francesco obviously has undergone a cardiac surgical procedure, but he has a very, let's say, very interesting story that goes beyond cardiac surgery, and I'll leave it, Thank you.
Thank you. We're very similar, tall, good looking, lots of hair. So I just wanted to thank Temerty Medicine and Dr. Bisleri for the invitation to join you this evening. But more so, I'm feeling more grateful to access the phenomenal medical system that we have here in this city, at a hospital where my father-in-law and mother-in-law trained and my 4 kids were born. My primary reflection about my surgery and my heart valve situation is gratitude. A few years ago, during a regular checkup, my family doctor found that I had an irregular heartbeat. I was sent to the cardiologist, and they identified that I had a leaky valve. At the time, surgery was not required. But last summer, late in the summer, I had a follow-up investigation, and I was told that I would need open heart surgery to repair the valve. I'm a bit of a chicken when it comes to hospitals and doctors, and the prospect of surgery was really daunting to me. I was referred to this surgeon, a nice Italian gentleman, and the next steps I met Dr. Gianluigi Bisleri. Dr. Bisleri said he had hoped that the valve could be repaired, but it was also possible that it needed replacing. He explained the details of the function of the heart and described a new, less invasive surgery technique that was developed. An approach to fixing the valve would not include, I keep saying cracking my chest, but I like slicing the breastbone much better. And then I wouldn't have to endure a 6 to 8 week recovery. Dr. Bisleri would do some more tests to see if I had complications or symptoms, and said it would be best to do the minimally invasive approach if possible. I was relieved at the prospect and found myself counting on the possibility of a new approach. Once the investigative testing was done, I was ready to get on with the surgery, and the date was set for December 19th this past year. As a family, We had been through significant health crisis before. In 2001, while I was working as a money broker in New York, I was caught in a building when a plane crashed into the World Trade Center and entered our company floor as I was just leaving. My escape was perilous, but I survived the collapse and was rescued from underneath the building. I suffered burns and blasts and broken bones. I suffered respiratory illnesses and serious damage to my eyes. My wife and family went through hell worrying about me and then supporting me on this long recovery. Although I do not remember much of that time, the early days, I do remember that my return to health was significant and through a physical and psychological journey. With the prospect of a big heart surgery, the worries came back to me, and I worried about the toll it would take on me, and the events that would happen would take a toll on my family. On the day of the heart surgery, my wife and I were received with a fabulous team of nurses and anesthetists, and I was ultimately introduced to Dr. Bisleri's team in the operating room, who all prepared me and supported me and my family, acknowledging the anxiety and trepidation that we faced, and responded with exceptional care. I woke up from the surgery, was incredibly relieved. Dr. Bisleri had been able to proceed as I had hoped and had repaired my valve through the chest wall. I spent a few days in the ICU with the support of many great healthcare providers. My progress was closely monitored before I moved to the cardiac surgery unit, where I steadily improved, allowing for my discharge just 4 days after the surgery. At home, I slept a lot. I moved gingerly, but was able to manage my pain with over-the-counter medications and clear instructions for monitoring my health, so I could feel confident that I was steadily improving. Within a few days at home, I could walk around the block and move up and down the stairs freely and steadily after 10 days. My family gathered on the 29th to celebrate a belated Christmas. Although I did not help in the preparations of the meal as usual, my family claims that I was holding court. But unfortunately, I was still not able to do the dishes. 3 weeks after the surgery, I was able to go back to work, initially doing shorter days so that I could recover a little bit and get myself the extra sleep that I needed. But soon I returned to full days the week after. I began walking daily to the office, about 1.5 kilometers. And after my post-op check-in with Dr. Bisleri, I got the green light to start exercising, swimming, skiing. And I've been doing that for the last few weeks and literally have no challenges. I'm feeling great, and I'm very grateful for Dr. Bisleri and the team.
Mille grazie. That's all I got. And really what I wanted to mention is we are very proud of this. This is all very exciting, but by no means do we do it alone. I think the team is a very, very wonderful analogy, and we have an amazing team leader. But we really do rely on donor support along the way to catalyze the work, to seed the work, to sustain the work, depending on the situation. And this, of course, brings us to today. It's already been mentioned that we have a fundraising goal. We have a very lofty, ambitious goal, but I think the realization of Dr. Bisleri's vision and the impact that it would have needs a commensurate fundraising goal and fundraising opportunity. So we are striving to raise $3 million. It will establish the very first endowed chair in Canada in this area. You've already heard it's very, very rare and limited, but this would actually be the very first one in Canada. And I also am very excited to share that as of just a few weeks ago, we have received a conditional commitment of $1.5 million from a very prominent member of the Italian-Canadian community. So we have this, the conditional is very important because our task is to raise the other $1.5 million to get to goal. But we could not be more excited. We could not be more catalyzed ourselves to do the work, and which is why we are gathered here today. We really wanted to raise awareness about the work. The more people who know about it, the more people who see and hear the impact of it are certainly more likely to continue to spread the word and or support. Certainly if you're interested in learning more about being involved in any way, funding or actually just helping advance the work, I'd welcome an opportunity to chat after the remarks. But really just wanted to say thank you, and it's a pleasure to work with Dr. Bisleri, and I hope you join us in bringing all of this to reality. So thank you.
Buonasera, dottore, signora, ladies and gentlemen. It is an honor for me to be here this evening on my behalf and obviously on behalf of the province of Ontario. I really do appreciate the opportunity to be here this evening and to speak and to say a few words, because the groundbreaking work that's being done is extraordinary and extremely necessary given the impacts that it has on people's lives. I want to thank the University of Toronto's Temerty Faculty of Medicine for holding this event as well, in partnership with the Canadian-Italian Business and Professional Association, an association that I've been a member since I think I was 17 or 18 years old, and truly grateful for all the amazing opportunities over time to meet incredible business people in Toronto, and of course the networking that it does throughout Ontario and all over Canada. So thank you for having me here tonight and doing these types of events where we learn about innovation, we support healthcare, and the significant contributions that all the members make, regardless of whether they're newcomers to Canada or people like me that have been around for a lifetime and are part of a great community that has done so much for the building of Canada and for the province that we live in. The Temerty Faculty of Medicine is also a pillar of excellence in our healthcare system, providing impressive and groundbreaking research, education, and of course clinical care. The impact of the Temerty medicine is tremendous, extending across Toronto and throughout Ontario and far beyond. And as I said, on behalf of our Premier, on behalf of our Minister of Health, Sylvia Jones, and our entire government, thank you for your enormous contributions to our province and for being an instrumental healthcare partner and a leader. Focusing on innovation, evidence-based care, and best practices is critical to improving the healthcare experience of all Ontarians. And in mental health and addictions, it's the basis of the investments that are being made each and every day in the province. It's a big part of providing individuals and families with more connected and convenient care and building a stronger and more patient-oriented system of care. So I want to say thank you, Doctor, for choosing Toronto, for choosing Ontario. It is the best province in Canada. It's the best people in Canada. And I have to say, the largest. This fact is undisputable. The other ones may be questionable, but it is the largest group of Italians outside of Italy living in one place.